Welcome parents to our suicide prevention training that's accessible to you online. This is part one of a two-part video series on suicide prevention. My name is Elise Greenaway and I am a social worker with the Pleasanton Unified School District, and we put this training together for the purpose of equipping you as parents, and we wanted it to be something that is accessible to you from home and available whenever you want the information. We're going to start off by just covering a disclaimer. We recognize that this can be a really sensitive subject, and our goal is to address it in a really informative way, but we want to encourage you, if there's any point in the presentation where you're feeling overwhelmed or triggered, to just take a break and come back to it later. We're going to start off by going through some statistics on suicide, and we're not going to spend a ton of time, but we do want to cover some important statistics for you. So unfortunately, suicide is the third leading cause of death for young people ages 10 to 24. So that's basically the majority of our, the typical age range for middle school and high school students. But we do, in the Pleasanton School District, we have seen students struggling with suicidal thoughts even as young as elementary school. We know that for every one completed suicide, there are 25 attempts. So we hear these numbers of suicides in different areas, but we only know the completed ones. We don't necessarily know the attempts that are going on behind the scenes. 4 out of 5 students who attempt suicide have given clear warning signs, which can be a pretty daunting statistic, but this is actually a positive thing because it means that there is something that we can proactively do to support our students who are showing these warning signs. And then lastly, the rate of suicide attempts is 4 times greater for LGBT youth and 2 times greater for questioning youth than that of straight youth. So this is just an important thing to keep in mind when we're looking at our most vulnerable populations. This is a group that struggles more in this area. Assembly Bill 2246 was something that was passed last year, and this has influenced our approach as a district with suicide prevention. The bill, we're not going to go over the entire bill, but I just want to highlight a couple things that it talks about. It shares that children and teens spend a significant amount of their young lives in school, and so the personnel who interact with them at school, like teachers, administrators, counselors, even the campus supervisors out at lunch, are in a prime position to recognize the warning signs of suicide and make the appropriate referrals for help. And it also talked about that the primary person that a student might turn to if they're struggling, or if a friend confides in them that they're struggling, is a teacher. And so for this purpose, we are really working hard on training our district staff. We have this training online and it is available to all staff. And we also have been going around and presenting at all of our different school sites with the goal of equipping our district staff to be able to support students that are struggling in this area. We also want to make sure we clarify that although research is showing that school staff is an important part of suicide prevention, parents are also a very extremely important part, and that is why we want to train you guys to partner with us in this prevention effort. Some common myths surrounding suicide that are important to address are that talking about suicide will plant the idea. So a lot of parents are concerned and scared to ask their student, are you struggling with the thought of suicide, or are you thinking about hurting yourself? Because they're worried, well, if they weren't thinking about that before, is this going to plant the idea and make them think that that would be a good solution? Research shows that it's the opposite effect. So it actually can take off a burden that a student might be feeling and make them less anxious and less overwhelmed if they can just think and talk about this concept out loud. We also hear that someone who talks about suicide is just trying to get attention. We know that sometimes that can be the case, but in this situation, it's always better safe than sorry. So although some students do use this as an attention-seeking tactic, we want to be aware of the fact that a lot of the students that are talking about attempting suicide will actually follow through with this. And we'll talk a little bit more about that later as a red flag. And then if someone wants to commit suicide, there's nothing you can do to stop them. This is also false. There's a lot that we can do, although we never can take responsibility for someone else's life and their choice to end it. There are things that we can do as far as recognizing red flags and connecting them to the appropriate support. Although there's no one specific cause for suicide, there are several areas of contributing factors that we want to address. So, those three main areas are health factors, environmental factors, and historical factors. So, when we look at health factors, we know that 90% of students that make a suicide attempt have a treatable mental health disorder. Treatable is the main phrase that we want to emphasize here. So, that means that it's something that if they were to seek out support for, if they were to seek out mental health treatment, that it's something that we could get them assistance with and they could, you know, see markable improvements in their mental health. Substance use disorders are also a big deal. So when you're under the influence, you're not always thinking clearly. We also know that things like depression are made worse when we use substances. And so if someone that is feeling suicidal is using an illegal substance to possibly self-medicate and try to make themselves feel better, it can actually make their depression worse. Things like serious or chronic health condition or pain are another thing that we want to be aware of. So if a student has this terrible pain that they're dealing with all the time, it would make sense that suicide is something that would cross their mind because it would be a way to escape this pain. Traumatic brain injury, smoking are also health factors that can impact the chances of depression or the chances of depression that leads to suicidal thoughts. And then antidepressants. I really want to emphasize here that we are not promoting or discouraging people from taking antidepressants. We have a lot of students in our school district that are taking antidepressants, and it has drastically improved their quality of life. But we do just want to emphasize that one of the health risks that doctors talk about when they prescribe you an antidepressant is that if you have the side effect of suicidal thoughts, you want to immediately contact them. So, again, we understand people have very strong opinions morally and ethically about taking antidepressants, and some people feel strongly the other way. So, we're not promoting or discouraging it. We're just saying that one of the things that can be a side effect of taking an antidepressant is suicidal thoughts, and we want to be careful about that. As far as environmental factors, access to lethal means is a big one. So if there are medications that are out and about in the home, not locked up, if there are guns that are accessible to students, those are concerns. Prolonged stress, stressful life events, exposure to another person's suicide. So this is why when we do have a student that commits suicide, we need to be really careful with how we respond. We want to be respectful and memorialize them, but we also don't want to make such a big deal about it that it triggers other students to take the same action. Like we talked about earlier, gender confusion, and then hopelessness, so tunnel vision of feeling like this pain is going to last forever and I don't know how I could ever get out of it. Some historical factors that influence students as well are previous suicide attempts, a family history of suicide, and then past abuse. So we want to emphasize here that just because a student has family members that have committed suicide in the past or they've experienced past abuse, this does not necessarily mean that they're definitely going to struggle with suicide, but it's just something for us to be aware of in the big picture. Some red flags that we want to go over are things that they might say, behaviors, and then moods. So students that are talking about feeling hopeless, if they're actually threatening suicide, they're sharing they have no reason to live, they feel like they're a burden to others, feeling trapped, or talking about some kind of unbearable pain. These are things to be really attentive to. Like we shared earlier, a lot of times the students that are talking about suicide are very serious about it. Behavior is also challenging to keep an eye out for, but some things you can look out for are reckless behavior. So this could look like doing, really dangerous things, and this can also include an increase in substance use. Stops or starts taking medication abruptly, like we talked about before with antidepressants. One of the side effects can be medication We also see a lot of if students decide that they want to take themselves off their medication and they don't taper off it and they just immediately stop, this can be a huge trigger for suicidal thoughts. Searching online for materials or means of ways to kill themselves, withdrawing from activities. So if they used to be super involved with the soccer team and then all of a sudden they're not interested in attending practice anymore, they don't get excited about games anymore. Isolating from family or friends, sleeping too little or too much, in the same way eating too little or too much, and then visiting or calling people to say goodbye, giving away prized possessions, being aggressive. A lot of times with adolescents, depression manifests itself more with aggression than sadness. Writing or artistic expressions of death, and then neglecting personal responsibilities such as pets or schoolwork. When it comes to moods, this is another really challenging thing because when we talk about the people that are most at risk for suicide are teenagers, and mood swings are already a pretty common thing with them. So we want to remind you to just be looking at their baseline and what is normal for them, and when they veer away from their baseline is when you are going to be concerned. So things like depression, extreme mood swings, anxiety, loss of interest in things they're previously interested in, irritability, humiliation, agitation, rage or seeking revenge, and then extreme distress followed by a sense of peace. And this can be because they've discovered, what their solution to their problem could be as far as taking their lives. In our next section, we're going to cover some protective factors and some practical things you can do as a parent to prevent suicide and intervene if your student is actively suicidal.